Hello, it's great to have you here with us at Neurotrauma Simulation Center 2023. Can we start by telling me a few things about your background, your focus in your practice? What do you do?
Yes, I'm an anesthesiologist. I'm a department head of the Department for Anesthesia, Intensive Care and Emergency Medicine in Wiener Neustadt, which is a big hospital south of Vienna, about 850 beds, and we are affiliated to some universities, and we are a university teaching hospital. We have a main focus on traumatology and neurotrauma, and we treat about 30 to 50 patients a year with severe brain trauma in my department, which is the intensive care unit especially.
And what motivated you to be part of this program?
Well, my motivation is, I think that caring for neurotrauma patients, for patients with severe brain trauma, is one of the king disciplines in medicine, starting in the primary health care in the field when the patient has his accident or car accident or whatever it happens to him, and we go out with a helicopter and we give him a treatment on site with anesthesia, ventilation, bring him to the right hospital, make the decision which hospital is the best for this patient, and treating from the trauma room to the intensive care unit or in the OR, and then bring him to acute care rehabilitation. So we try to get the best out of this emergency, because to my opinion it's not the point if you survive a brain trauma, but how you do survive it. And so I think it's from the first moment you have to make a very pronounced best care for these patients. And this motivates me also to give this knowledge to the colleagues and discuss with colleagues from other parts of the world, and that's why I'm glad to be a part of this course here.
Do you know any other programs like this one?
Well, not focusing specially on this neurotrauma. This I think is unique, and for that it's a very good focus, because we cover all the areas. We have also a simulation center in my hospital in Wiener Neustadt, and we train the emergency physicians giving pre-hospital anesthesia. We train them how to intubate, we train them how to make a precise medicine for these patients. And these are also some points that we try to give in this course, and intensive care and operating techniques, and so I think this is a very special focus.
What do you think are the top challenges when it comes to the approach of neurotrauma?
Well, I think one of the main challenge is to get a good crew outside, to get the patient to provide an experienced emergency crew, so that you don't have troubles in giving anesthesia, too deep anesthesia, to blow out the blood pressure so that the patient has no perfusion pressure anymore. This would be deleterious, and also to give intubation in a fast way, not to have the risk of hypoxia. So this is a main challenge in the first point. The second point is when the patient gets to transportation, to get him to the right hospital, which can treat him until he can be handed over to rehabilitation. So not make a hospital hopping, but go to the best hospital in the shortest time. And then once he's there in the emergency room, that you have an experienced team in the emergency room consisting of anesthesiologists, intensivists, neurosurgeons or traumatologists. And then once the patient had his operation, or if he doesn't need one, he comes to a good intensive care unit where you are experienced in treating this kind of patient, because it's not the same if you treat a neurotrauma patient as you treat an abdominal surgery patient, for example.
Correct.
So
yeah.
this should be really specialized care. And the last point is to find good rehabilitation centers. This is where we have a lack in Austria, where we don't have enough facilities for giving optimal care in the terms of neurorehabilitation on the long run.
Mm-hmm. Can you tell me about maybe just one, it might be hard to choose, of the most complexest cases you ever encountered, or an interesting one?
Well, yes. this is one point that we have implemented in our treatment is the thing with neurorehabilitation, drugs for neurorehabilitation. And we, since we do this, we see very interesting developments. Patient with diffuse axonal trauma, for example, after a high-speed accident with a motorcycle. And we had him in the intensive care unit for more than 8 weeks. And it was a very long acute phase. But this patient developed very fine, and I met him some months ago. It was about 18 months after the trauma, and he was walking by himself. He was quite good from his mood, and he told me that he will go for the driver's license exam once again because he wanted to show that he is able to drive a car and drive a motorcycle even after this big accident. So this gives you the feeling that you do the right job. And this is something that motivates our personnel very much. We invite these patients also to come and visit us in the intensive care unit.
That's great. It gives you hope that things can work out great. The AMN network is working to develop a guideline alongside other societies. Which topics do you think should be addressed in that guideline?
Well, we have the guidelines for the, especially for the Brain Trauma Foundation, and these are good guidelines which are followed, I think, quite all over the world. But I think what is a big focus could be for the AMN network is this story about neuro-rehabilitation drugs to give the patient the possibility to repair the traumatized tissue. And we have 2 or 3 substances which are quite giving hope in that case. So, you know, the CAPTAIN trial, which showed that patients have a far better outcome in terms of depression, in terms of cognitive abilities. So I think this could be one of the main focuses for AMN.
Great. Thanks so much for your time and for your answers.
It was a pleasure. Thank you.
Thanks.